Good morning, everybody. Good morning from the South Dade Chamber. I am Lisa Greer, board member of the Chamber, and here with me this morning, I'm happy to have Eunice Hines. She is the Director for Migrant Health Services and Outreach for Community Health of South Florida, Inc., or CHI, as we've all grown to know it. Eunice, your name is followed by quite a few initials. I only have a Mrs. in front of my name, but you have quite a few initials behind your name. What are they?
I am certified community health worker and a certified health coach.
Excellent. Well, that's very impressive. And I know that
Thank you.
CHI is happy to have you with them. So thank you for your commitment to furthering not only your education, but your commitment to the communities that we serve. So looking at readily available information about CHI, CHI has been a household name for 50 years now, right?
Correct. We just celebrated anniversary last year.
Excellent. What a great accomplishment. What a milestone, and one to hold with great pride. CHI's beginnings at the vision and determination of Ms. Doris Eisen, with her mission to ensure that available health care for those who couldn't gain close access in much needed areas. And what I saw was that has resulted in expansion over its 50 years to 11 centers and 35 school-based programs. There's locations as far south as Marathon, Florida, as far north as Coconut Grove and South Miami, correct me if I've missed any, and west to West Kendall near the Miami Executive Airport that we all know as Tamiami Airport, but Miami Executive Airport. So many awards I saw on CHI's website that were very impressive. HRSA, Department of Health and Human Services, did I get that right?
Correct.
Good. For being the top 25% health centers throughout the country, with recognition for exceeding national quality benchmarks. That's impressive. So I congratulate you on those. And when I looked at the services that are provided that were recognized with these awards, as they are compared to more than 13,000 other health centers around the country, I emphasize that again, the country, included things as like diabetes control, high blood pressure control, weight assessment and nutrition counseling for children and adults, intervention for smokers. And then CHI is also one of the one-stop shop service providers for primary care, OBGYN, dental. I didn't know that.
Behavioral
services, vision, urgent care, pharmacy, radiology, lab services. There is so much going on in the CHI locations that I don't know if our communities actually know all this. So I'm so proud to be able to share this with our audience this morning.
Absolutely. We do have 10 centers in Miami-Dade, 3 centers in Monroe County, and that covers Florida Keys, Key West, Marathon, and Tavernier. We do have out of the 10 centers in Miami-Dade, 1 is in Coconut Grove, which right now it's being reconstructed, expanded.
Nice.
So the patients that we usually would have seen Coconut Grove, they're being seen in our South Miami area or center. Then we do have one that's coming and soon to open at the Hammocks Health Center, which is fairly close to the one at West Kendall.
Okay. It just expands the services to the West Kendall community,
Yes,
right?
ma'am.
Which is very, very important. Interestingly enough, I'll give you a little factoid. My husband's mother was one of the first physician's assistants at CHI in Miami-Dade County. So
what year was that?
It's just been a long time. So we're not going to date ourselves here on this show, but it's just been a really long time. So, but it was probably in the 60s, if I had to imagine.
Okay.
So, yeah. 60s or 70s possibly. But I also saw that CHI is the first federally qualified health center in the nation. Again, we're talking about countrywide, to be awarded the Governor Sterling Award. I'm not sure what that is, but it certainly sounds impressive.
Yes.
So congratulations on that. So a little bit about you, Eunice. How long have you been with CHI?
I've been with CHI for about 14 years. Left my youth there.
You started at 10.
Yes, you're correct. Started in the administration office. Then I was able to direct the migrant department. And then I was given the outreach department. And now I oversee also the medical mobile van. We have 2 units,
Nice.
one dedicated to dental and the other one primary health services and behavioral health services in public housing locations and the homeless encampment.
I'm interested for you to tell the audience what brought you back. What brought you to CHI?
What brought me to CHI? Well, I remember going to CHI at the age of maybe 16. And that was when we had just arrived from the West Coast, because I was raised in California.
Mm-hmm.
And of course, I started my senior year at Southridge Senior High. And my mother took me to Doris Eisen on 216
Oh, yes.
to get the Hep B. And I was, young kid, I was like, oh my goodness, what is this? I was just amazed. And then, life took place, came back in 2006. I was working for another FQAC up north, or a sister company. And there was an opportunity to work in the administration office. I applied, and here I am.
14 years later, you have spent most of your youth.
And I loved it. I enjoyed it. Never wake up, thinking like, oh my God, I gotta go to work. I really enjoy what I do, helping the community. And I've been blessed to be given the opportunity to really make a difference throughout all these years.
So what a nice combination. We've got an organization, an agency that provides such needed healthcare and behavioral services and ancillary services to our community, but then it's obviously a great place to work.
It
It's
is
a great place to work. I know that we have, I know Colonel Brodus Hartley, and I know that he's retired, and I know that he's had a great impact on the expansion and reputation and respect that CHI has deserved. And I couldn't continue this interview without giving him a little kudos on that. He's such a great, wonderful man.
Yes, he is.
Yes. So tell us about anything that you would like to share about CHI. I've covered a lot that I've seen in on website and social media, but tell me what you'd like to talk about.
So I would like to talk about the services that we provide with this medical mobile van that I oversee. It was created with the idea of providing services to the community during disasters. Okay. Especially, how we always get hit for, hurricanes and whatnot. And so here we are in a pandemic. Nobody thought about the pandemic. And so at the end of July, we took it out to the community. We were bringing primary care services, behavioral health services, and also linking them to resources all throughout Perrine Gardens, Arthur May Villas on 216.
Oh, yes.
Pine Island in Naranja, Homestead Gardens in Homestead. And of course, at one point we were working with the Homeless Trust to just go to different locations to reach the homeless population. We then, did testing, vaccinations as well. We continue to do that. Our centers also do testing 7 days a week, vaccination 6 days a week, and we work on a schedule. So we're talking about all of our centers take a day to just do, the testing and vaccination all throughout Monroe County. And so, a lot of the what I do want to talk about is just the services that we provide in this van: primary care services, behavioral health services, GYN services, labs. Pinpointing the social determinants of health for all of these residents that come. We see people on appointments, but we do have a lot of walk-ins. And that's only because people see this van and they're like, what are you guys doing? We tell them a little bit about what we're doing. Oh, well, let me go see a provider. Right there, we also work with the outreach team. What do the outreach team do? They do screenings. They do public benefits enrollment, insurance enrollment right there on the spot. They assess the families to see what their needs are, and we just link them or refer them to these non-medical social needs. And that's very important, because if you don't have everything that you need at your home, your healthcare is not a priority.
Absolutely.
Okay, so when we take care of those little things that are in their head that worries them, take care of their kids, give them, resources, link them to food, link them to just, Pampers, link them to, maybe they want to fix their credit. We link them to that.
My goodness.
You really make an impact. So that way, they're checking off certain things from their list to become active in their health. So they're self-managing.
Those are lifestyle changes.
Correct.
And you're introducing that to a community that may not otherwise have that as a priority.
Exactly.
So just for my own my own mind, my own understanding. The vans go out into the community. Do they pick people up and bring them to the center, or did they bring the services to those locations?
So that would be transportation. But what the medical van does, we bring the services
Oh my.
to their homes,
Okay. Oh my.
right there in their parking lots.
Oh my. You can't get any more convenient
No.
than that. And what a great way, like I said, to, share the wealth, share the
Mhm.
education, and make someone's life different.
Mhm.
And, once you do that with one person, they tell somebody else, and then they tell somebody else, and they're going to be looking for those vans.
Yes.
Wow. And how many vans are there?
Well, the one that I oversee is one van,
Okay.
one medical van. There
Okay.
is also a dental unit.
Okay.
And that one also sees children. They go to schools, daycares, and wherever they're needed. If we're doing a health event and the van, the units are actually available,
Mhm.
we go to to
Mhm.
those events and just do screenings. And the whole point is to be able to give them, an opportunity to find a primary care physician.
Mhm. So during the pandemic, we've all been affected by that. So CHI is providing the testing and the vaccinations during the pandemic, I presume, as well as maintaining normal service operations for
Correct.
those that need it.
Mm-hmm.
Okay.
Yes.
Any closures during the pandemic or no?
None.
Wow. Amazing.
None.
Amazing.
It seems
Thank
like
you.
everybody just kind of stepped up to the plate. And
Isn't
we
that
definitely did
amazing?
our public health duty.
Isn't that amazing?
Yes.
That's wonderful.
No
That is
closures.
wonderful. So Eunice, there's so much going on with CHI and always has been, and it's ever expanding. What's next on the slate for CHI?
So for what's next, we're still trying to up and run the crisis unit, the children crisis unit. So we do have a crisis unit at Doris Sison.
This is the one on
216th.
216th Street that
Mhm.
everybody recognizes as
Mhm.
CHI.
And so we're trying to also open a children crisis unit. Our goal is to see at least 1,000 children a year.
Oh my.
Okay. And so that one's going to be right there in the back of, I want to say the back, but more like the front of Doris Sison on the
Mhm.
corner of 216, right before the entrance.
Mhm.
And we also, with the hammocks, the one that we want to open, we want to be able to dedicate that center to the seniors.
Nice.
That's what we're working at right now.
Nice. Nice. Very nice. So senior services, children's services, expansions. I've seen the construction on 216th. It looks like it's going to be absolutely phenomenal and can't wait for that to happen. And for those of our viewers that don't know where that is on Southwest 216th, just east of the Florida Turnpike overpass, correct?
Correct.
Between the Florida Turnpike overpass and Old Cutler Road. That's like the main location.
Yes,
but then,
it is.
like we've talked about, there's numerous other locations throughout the communities
Correct.
to take advantage of. So I read online there's possibly some expansion at the Marathon Health Center.
Probably.
Website is phenomenal. Possibly an opening in the Overtown area.
I have heard of that one too.
Okay, excellent. And of course, I guess expansion of diabetes care. It said at the Doris Sison Center, which is on 216th Street, with new vehicle entrances, more than 400 parking spaces, and a deli.
Yes.
Right?
At one point, actually, when the pandemic hit, we weren't seeing any patients inside. We were actually doing a lot of telehealth and doing drive-throughs, and we were actually seeing our chronic ill patients in a drive-through manner. So yes, the diabetes were actually being seen through drive-throughs, hypertension, and that's how we were addressing it. So no, there was no reason for us to slow down or close any centers because the need was there.
Sure, absolutely, the need is there, and is for anybody that understands how silent and deadly diabetes can be, you don't know that it's an issue until you have some adverse effect of it. So it's pretty encouraging to know how many services are available.
Right. That's one of the it's actually the outreach workers. What they do is they screen at each event. We don't do anything else. We do the screenings because that just right there, based on the numbers that the patients give when we do the screening, we link them to a center, to a primary care physician to be seen immediately. And so when we work hand in hand with the mobile unit, we have a provider right there and then, which has happened.
Wow.
And helps them out, reduce those numbers very quick before they end up in a coma.
Amazing. The more that we can do on a preventative basis,
yes,
the better we can, the better health that we have as a community.
Absolutely.
So and the better balance we have between our centers and our hospitals and healthcare services and so forth. So CHI has federal funding. However, I would imagine that CHI would always appreciate any opportunity to and encourage donations from the public. CHI has an event coming up.
We do. We have the golf tournament now on May 16th. It will be held at Deering Bay Yacht and Country Club. Very excited. I am out in conferences all month, but I will be back to participate and see everyone and, just kind of like regroup again and see each other. Right?
That would be
That would be
excellent.
fun.
Yes. I think we're enjoying our newfound freedoms out here and out in the world and appreciating
Yes.
having not seen anybody in person and each other in person for so long. So please take a look at CHI's website to get more information about the golf tournament. Get involved if you'd like, donate if you like. And that would be CHISouthFL.org.
Correct.
CHISouthFL.org. Please feel free to peruse the website. Take advantage of the opportunities coming up. I believe you'll see the website on the ticker on the screen. So please do that.
Give us a call. You want to make an appointment. You don't know if you have insurance. If you have insurance and you're not sure what your insurance covers, give us a call. We have people, outreach workers that will be able to assist you and get you in as soon as possible.
I'm glad you mentioned insurance, Eunice, because I believe, and wrongly, I am one of them, there's a lot of people whose perception is that CHI helps those who don't have insurance coverage. That's not the case, is it? And a lot of times it is, but
trust me, yes.
Yes.
But we serve everyone, whether you have insurance, not insurance, don't have the means to prove that you can get insurance or not, because we're here to serve the underserved population.
Mhm.
We're talking about the migrants.
Mhm.
A lot of them do not have, Hines status or anything like that. So we're here to serve them. We're here to be able to provide them services on a sliding fee scale. Okay.
Mhm.
And if you don't have insurance, we will help you to see what we can qualify you for, whether it's Medicaid, Kid Care, the Marketplace with the Affordable Care Act, otherwise known as Obamacare.
Mhm.
Do all of that.
Mhm.
My team does that.
And you work hand in hand with the patients to ensure that they can get the optimal care with the optimal coverage.
Correct.
That's wonderful. That's wonderful. Again, folks, CHISouthFlorida.org. Make sure to take a look at it. So Eunice, I would be remiss if I didn't thank CHI to be a member of the chamber. We are extremely grateful for the partnership and the membership, and we look forward to that relationship growing over time. We're certainly very proud of what CHI has done in our community and for our communities to help make our communities the best place to live, work, play, pray, and learn. That's a great tagline for
Yes,
Deep
it
South
is.
Dade. Yes, yes. So folks, also for those that are listening and watching, I encourage you to always peruse the South Dade Chamber's website as well. That's southdadechamber.org for the latest and greatest. In fact, we've got coming up on this week on April 28th, we've got a spotlight on the Redland with a focus on our beautiful Redland venues, which are aplenty. And they are beautiful. So 8 a.m., it's a breakfast. It's limited space. So please go to the website and make sure you reserve your spot. It's going to be held at the beautiful Casa Tranquilla in the Redland. So take a look at that and see if you can join us for that morning's information. Also be on the lookout for the upcoming Ladies of Legacy Luncheon, which will take place on Thursday, June 9th at 11 a.m. at the iconic Mercedes-Benz of Cutler Bay. So in our backyard. Please be on the lookout for that. South Dade Chamber thanks all of its trustees, its members, its sponsors, and Eunice, we thank you for being here with us this morning for this morning's shout out. We always thank our partner Community News for hosting our time here on Tuesday mornings. We thank you all for listening in, watching, and we encourage you to share this with your friends and families and so on and so on and so on, so we can get the good word out, not only about the South Dade Chamber, but also about CHI and its services. And with that, I wish everybody